Hi, I'm Adrienne Nolan-Smith. I'm founder of WellBe, and I'm really excited today to introduce Dr. Ellen Vora to you. Ellen and I happen to be neighbors in the same apartment building, which is totally random, and met recently. And it's very exciting for me to have her on the show today because she's an integrative psychiatrist. She's board certified by the prestigious Columbia University, but she's also a licensed acupuncturist and yoga teacher. And the topic of integrative psychiatry is really important to me at WellBe for a couple of different reasons, but if you've seen the video that's on our site right now about my mother's experience, she had been diagnosed for 5 years with schizoaffective disorder and was sort of revolving door of mental hospitals until she passed away in 2010. But a lot of what I had believed to be missing in her care is exactly what Ellen practices today. So for many reasons, this is really, really exciting for me. So I have a couple of different really exciting things to talk about with Ellen. The first of which is, do you ever get to practice psychiatry, acupuncture, and yoga therapy on patients at the same time?
So yeah, I think it does come together sometimes. I would say the thing that comes up least in my practice would be yoga. I always, when I was pursuing all of these different trainings at the same time, psychiatry residency, acupuncture training, and yoga, I was always thinking like, how the heck is this going to come together? But I just was like, just keep going forward and we'll figure it out. And it turns out that yoga, it's more like an overriding philosophy that I bring to my practice. And sometimes I'll recommend that people do yoga. Sometimes I'll bring up things like the yamas and the niyamas from yoga philosophy as just a way of having, it's almost like a yoga cognitive behavioral therapy. So I have people look at those tenets and start to think about that in terms of their care. But very rarely are we like busting out triangle pose in a session. But certainly acupuncture and psychotherapy and psychiatry, that's all coming together in a session. And I don't do acupuncture with every patient, but for a lot of patients, it can look like somebody is actually like on the table with needles in and we're doing psychotherapy while they're lying there with needles in. And for other patients, it's more like we talk for half hour, 45 minutes, and then we switch over to acupuncture.
Okay. Wow, that's really interesting because you know a lot of psychiatrists today are not acupuncturists or yoga certified, so it's pretty unique and I think pretty cool.
I hope more over time.
Yes,
I think that it's a growing field and it should get a lot bigger. It's a natural fit.